My name is Sandra, and I had a total knee replacement on my left knee. The reason I had total knee surgery goes back actually about 15 years ago when I started having issues with my right knee. This last year was sort of the turning point for me. I was doing a holiday cooking and was on my feet for almost 3 days. The next morning I woke up, I couldn't walk, and I was in excruciating pain, this time with my left knee. It was compromising walking on the stairs or playing tennis. Every night when I went to sleep, I woke up every 2 to 3 hours with excruciating pain. It felt like somebody was stabbing my knee with a knife. I knew in my heart at this point in time, with both knees, compromised, I had to do something. Decided to pick the surgeon. I had actually 4 names on my list. I came away with making my decision to use Dr. Karadsheh. Dr. Karadsheh is very cutting edge in his thought process and always tries to do what is current and what is going to be best for the patient. Dr. Karadsheh first recommended that I get acquainted with the X10 machine a month and a half to 2 months before I actually had my surgery. And I absolutely, totally fell in love with that machine. And it did more than I ever could imagine in preparing me for the surgery. I was so happy to come home to the machine that I had used previous to surgery. It was just like having a friend sitting in my house with me. And it was fun for me to have something to judge where I was before and where I was going to be and have that goal. 1 month after the surgery, I can say I still have another week with the machine. I'm at 0 and 127, so I'm just 3 degrees short of where I'm going to be, but I know I'll get there. I do have to have my right knee done, which I'm going to have 3 months after the left one, which I had done first. And I am actually looking forward to having the second one done so I can have both surgeries behind me and I can go ahead with the quality of life that I'm looking for. I have 2 wonderful granddaughters that I want to be able to move and play with, get on the floor and do a lot of activities. We're avid travelers. I want to be able to do stairs, climb, travel, not feel like I'm limited in any way. And I'm actually feeling very confident in having the second one done 3 months later after the first one.